Good morning, everyone. Today, we will be discussing an essential aspect of nursing assistant roles: delegation. Understanding delegation is crucial for providing safe and effective care under the supervision of licensed nurses. We will explore the definitions and rules about delegation, the guidelines for performing delegated tasks, and the process involved in safe delegation. By the end of this lecture, you will have a comprehensive understanding of what delegation entails, how to perform delegated tasks safely, and the importance of communication and supervision in this process. Nursing assistants function under the supervision of licensed nurses, advanced practice registered nurses, APRNs, registered nurses, RNs, or licensed practical nurses, licensed vocational nurses, LPNs, LVNs. Nurse Practice Acts give nurses the authority to assign or delegate nursing tasks to nursing assistants. Definitions and rules about delegation vary among state nurse practice acts, agency job descriptions, and national organizations such as the National Council of State Boards of Nursing, NCSBN, and the American Nurses Association, ANA. It is essential to know the rules about delegation in your state and agency. Delegation involves authorizing or directing a nursing assistant to perform a nursing task that may be beyond their usual role. Some tasks are part of the nursing assistant's routine work, such as feeding, moving, and transferring procedures, hygiene and grooming measures, and measuring weight and height. These tasks are commonly assigned to nursing assistants and learned in their training programs. However, some states and agencies allow nurses to delegate tasks that are not routinely done by nursing assistants. The NCSBN and ANA outline guidelines for safe delegation of such tasks. The person delegating must have the authority to do so. The task must be within the nurse's scope of practice and the nursing assistant's range of functions, and the nursing assistant must have the education, training, and competence to perform the task safely. Tasks that involve nursing judgment or critical decision-making cannot be delegated. Before performing a task, nursing assistants need information from the nurse and care plan. Delegation guidelines boxes in this textbook list the necessary information before performing a task and observations to record and report to the nurse. Tasks are identified as routine nursing tasks or delegated nursing tasks. Routine nursing tasks are part of a nursing assistant's usual work assignment, learned in basic training programs. Delegated nursing tasks are beyond the usual work assignment, but can be performed using the delegation process. Examples of delegated nursing tasks may include procedures related to urinary catheters, enemas, nutritional support, and IV therapy, measuring blood glucose, wound care, and oxygen therapy. States and agencies differ on what nursing assistants can do, so it is crucial to follow the rules in your state and agency. For safe delegation, several factors must be considered. Whether your state allows you to perform the task, if it is in your job description, if you have the necessary education and training, if you are competent to perform the task safely, if you have reviewed the procedure with the delegating nurse, and if the nurse is available to answer questions and guide you as needed. Licensed nurses can delegate tasks based on their scope of practice. APRNs can delegate to RNs, LPNs, LVNs, and nursing assistants. RNs can delegate to LPNs, LVNs, and nursing assistants. LPNs, LVNs can delegate to nursing assistants if allowed by their state's Nurse Practice Act. Nursing assistants cannot delegate tasks, but can ask for help from coworkers. The delegation process involves assessment of needs, communication between the nurse and nursing assistant, guidance and assistance from the nurse during task performance, follow-up on problems or concerns, and feedback on task completion. The nurse must ensure that delegation decisions result in safe care for the person. Nursing assistants must protect persons from harm when delegated a task. They have two choices: accept or refuse a task. The 5 rights of delegation: right task, right circumstance, right person, right directions and communication, right supervision and evaluation. Guide these decisions. Accepting a task means being responsible for completing it safely. Refusing a task should be based on sound reasons, such as it being beyond legal limits or job description requirements, or requiring professional knowledge or judgment. In conclusion, understanding delegation is vital for nursing assistants working under licensed nurses' supervision. Delegation involves assigning tasks that may be beyond routine duties, but can be performed safely with proper guidance. Knowing your state's rules about delegation ensures compliance with legal standards while promoting safe care practices. Effective communication between nurses and nursing assistants is crucial throughout this process, from assessing needs through follow-up to ensure successful outcomes without compromising patient safety or well-being. By adhering strictly to guidelines outlined by national organizations like NCSBN and ANA, along with state-specific regulations governing practice acts and job descriptions, we uphold high standards, ensuring quality healthcare delivery across diverse settings where competent, skilled professionals play pivotal roles daily. Thank you all for your attention today. Let's continue striving towards excellence within our respective roles, contributing positively towards better patient outcomes overall.